The nicotine lozenge. By completion of this activity, participants will be able to describe the properties of the lozenge, list its advantages and drawbacks, describe its availability, cost, and coverage in the U.S., explain standard dosing recommendations, describe appropriate use, and list common side effects with mitigating strategies. Similar to the gum, the lozenge is one of the most commonly used short-acting nicotine replacement therapies. The lozenge's properties. Allowing the lozenge to dissolve in the mouth releases nicotine that is absorbed through the oral mucosa. Similar to the gum, peak blood nicotine levels can be reached in 20 minutes. It's available in several flavors, and most users find that newer flavors are preferable to the original one. There's now a smaller mini lozenge that resembles a Tic Tac, and this product dissolves more rapidly and delivers nicotine more rapidly than the original lozenge. Some of the advantages of the lozenge are common to the other short-acting nicotine replacement options. They're effective for sudden cravings, for use as needed. And another advantage is that unlike the gum, which requires chewing, the lozenge doesn't, so it can be tolerated well for smokers with TMJ, with poor dentition, or with dentures. The same drawbacks that are common to the other short-acting nicotine replacement therapies occur with the lozenge. It requires repeated use throughout the day, and it can lead to more variable levels of nicotine in the blood. Similar to the gum, the lozenge is available over the counter in the U.S. Priced on Amazon, the original lozenge is about 30 cents per piece and additional 10 cents per piece for name brand options. The mini lozenge is about the same for generics as the original lozenge, and then the brand name mini lozenge is about 5 cents more than the regular name brand lozenge. The Affordable Care Act requires that all Medicaid programs cover all tobacco cessation medications, and the lozenge, unlike the gum, which is covered in all 50 states and DC, the lozenge is not covered in 5 states, and those are listed here. Again, in South Dakota, it's only covered in pregnant women, and then the coverage varies by health plan in the states listed. The recommendation for dosing of the lozenge is, it comes in a 4 and a 2 milligram dose, similar to the gum. And the recommendations are if somebody usually smokes within 30 minutes of awakening, that indicates a higher level of dependence, and they're offered the higher dose of the lozenge. If someone smokes beyond 30 minutes of awakening usually, then the lower dose is recommended. The schedule for dosing is similar to the gum. It's 1 piece every 1 to 2 hours for 6 weeks, with a gradual reduction over the second 6 weeks, perhaps 3 weeks at 2 to 4 hours, 1 piece every 2 to 4 hours, and then the remaining 3 weeks, 1 piece every 4 to 8 hours. And then the total duration is 3 months. The maximum dose of the lozenge is 5 in a 6-hour period and 20 per day. It's a lot easier to use than the gum. It's just placing in the mouth and allowing to dissolve over 30 minutes. The side effects are mouth irritation and ulcers, which we found in the gum too, and an alternative form of nicotine replacement such as the inhaler might be a useful recommendation. Also, nicotine-related side effects of abdominal pain, nausea, vomiting, diarrhea, headache, and palpitations really can't be mitigated by changing technique like the gum, but could be mitigated by just using less lozenges.